I had surgery for breast cancer less than 2 weeks ago, but when the pathology results came out, my doctor said that I had to have another operation because the margins were positive. Why couldn't he tell cancer margins were not clear during the first operation? Is a repeat operation really necessary?
One of the frustrations I have heard from both my patients and members of my video audience is the possible need for repeat operations if a patient chooses to undergo breast conservation treatment. I completely empathize with the sentiment, and therefore, when offering breast conserving surgery, I assure my patient that I will do everything within my power and with the resources available to me to avoid such a situation. However, even with the best of intentions and efforts, a small percentage of women will still need to undergo repeat surgery. In this video, I will explain the reasons behind it with supporting scientific research data. Let's begin. In several prior videos, I have already discussed the data and evidence showing that breast conservation treatment results in improved survival outcomes or cure rates. Unless there are special circumstances precluding the use of breast conservation treatment or BCT, it should be offered as the primary treatment for early-stage breast cancer. However, women who undergo BCT need to be prepared for the possibility of repeat surgery. This is the subject of our video today. Please note that the information provided in this video is purely for educational purposes and is not intended to replace a medical consultation. Do see your doctor about your specific circumstances for treatment planning. Early in 1991, the National Institute of Health in the United States issued this consensus statement that breast conservation treatment is an appropriate method of primary therapy for most women with stage 1 and stage 2 breast cancer and is preferable because it provides survival rates equivalent to those of mastectomy while preserving the breast. About a year and a half after that consensus statement was made, there was still controversy about many issues surrounding breast-conserving surgery. Among them was how much breast tissue must be removed to provide an adequate margin to achieve local control. Before moving on, I wish to clarify the terms that we will be using frequently in this video. Local control refers to the absence of recurrence in the treated breast for women who had breast conservation treatment, or in the skin covering the area where the breast used to be if a mastectomy was performed. We refer to the percentage of patients who have no evidence of cancer in these areas as those who have had successful local control. It can be viewed as the opposite of local recurrence, where cancer appears either in the treated breast or in the skin covering the area where the breast previously was in a mastectomy. It is often presented as a percentage. When local recurrence is detected, it may also be called local failure. During surgery, while surgeons always attempt a complete removal, the edge of the cancer is invisible to the naked eye. It is only possible to determine margin status after the breast tissue removed at surgery has been sent for pathology examination. The anticipated margin status at surgery may or may not be the same as that when examined under the microscope. Processing of breast tissue to make cells visible under the microscope is not immediate and takes time depending on the strategy employed. After the tissue has been processed and studied under the microscope, the pathologist will be able to measure the narrowest distance from the cancer to the edge of the breast tissue specimen, which is inked. In this example, the red line indicates the dimension of the margin, and this margin would be reported as negative. In 1993, this team of doctors evaluated the association of local failure rate with margin status. At that point in time, the optimal extent of breast surgery required for patients treated with conservation surgery and radiation therapy had not been established. Doctors also realized that to achieve breast preservation with good cosmesis, it is desirable to resect as little normal tissue as possible, but it is also critical that the resection does not leave behind a tumor burden that cannot be adequately managed by radiotherapy. So the doctors sought to investigate if microscopically positive surgical margins are detrimental to patient outcome. The researchers studied 259 patients. Surgical margins were considered positive if tumor extended to the inked margins, otherwise the margins were considered negative. If the margin could not be determined with confidence, they were called indeterminate. These were the results from the study. In summary, the researchers found that for patients who had positive margins, 9% had local failure. For those with negative margins, 1.5% had local recurrence. Of women with indeterminate margins, 6% had local failure. In addition, they found that margin status had no impact on survival or freedom from distant metastasis. Based on their findings, the authors recommended re-excision for patients with positive margins because of improved local control. From this study, re-excision has the potential to reduce local recurrence by at least 5%. The natural question following this is, if mastectomy provides the widest margins, why is it not performed routinely so that women may be spared a second operation? Perhaps part of the answer lies in this study, which was published in 2024. This team of researchers from Denmark and Israel found that the risk of local recurrence after mastectomy is also associated with resection margins. So it is not necessarily true that mastectomy guarantees the widest margins. In fact, there are two salient points to highlight in this study. Firstly, that margins are important even after a mastectomy, and that if a mastectomy is performed and margins are found to be positive, it is difficult to locate its position in the breast as well as the position in the patient, especially after a reconstruction. The situation is different for breast-conserving surgery, where the site of positive microscopic margins seen at pathology can be identified. Regardless, this team of doctors still strongly advocate reporting of margins following mastectomy. Obtaining clear margins is an important aspect of breast conservation treatment. However, the potential for repeat surgery should not deter women from choosing this option. This large registry-based study found that patients assigned to breast-conserving surgery have a better survival than patients assigned to mastectomy. What is particularly interesting about this study is that it was found that patients going through an attempt of breast conservation prior to mastectomy had a considerably better outcome than those primarily assigned to mastectomy. Therefore, the data not only supports the use of breast-conserving surgery for eligible women, it provides evidence that starting out with breast-conserving surgery, even though it may not be successful in the end, results in improved survival or cure rates compared with choosing to undergo mastectomy directly. I wish to reassure women that there is continued effort in evaluating survival outcomes or cure rates of breast conservation therapy and mastectomy. More recent studies support earlier data demonstrating a survival advantage for women undergoing breast-conserving surgery with adjuvant radiotherapy for early-stage breast cancer compared with mastectomy. In addition, there are ongoing efforts to develop technology to improve the imprecision in breast-conserving surgery to reduce the high rates of repeat surgery for re-excision of margins. These techniques and technology strategies will be discussed in another video, and I hope you will join me there too. Thank you for staying and watching the video till the end. If you have found the information useful, please click like, comment, share, and subscribe so that we can make the content available to others as well. This is a tangible way we can assist women to make surgical treatment decisions for breast cancer that help them live longer and live more. See you again soon. Cheers!